Good morning, everyone. It's time for a Henry County Health Center FYI. And this morning we have Senior Life Solutions Program Director Chastity Lang on the phone with us to talk about Senior Life Solutions. So, good morning.
Good morning, Katie. Good morning, everybody.
Let's just start off with telling us a little bit about Senior Life Solutions.
So, Senior Life Solutions is a Henry County Health Center program, and it is designed to meet the unique needs of individuals, typically over the age of 65, experiencing depression and or anxiety related to life changes that are often associated with aging.
So, who makes up the team there at Senior Life Solutions, and what do they do?
So we have three on-site staff. Myself, I'm an RN with the Master's in Nursing. I'm also the program director. Chris Betzworth is our licensed social worker, who's also our program therapist. And then Jessica Landman is a CNA, and she's our office patient coordinator.
Can you elaborate a little bit on Senior Life Solutions and what services you offer?
Yeah. So patients meet up to 3 times per week in a supportive, encouraging group setting following an individual assessment. Our services include a confidential, comprehensive assessment, group and individual therapies, family therapy, medication, education, management, and aftercare planning, where we continue to engage and support our participants. Even though this is a group setting, each person is addressed individually based on their unique needs.
So, how does someone know then if they're eligible for Senior Life Solutions or a similar program, and can they be referred?
Yeah, so Chris or myself can provide a confidential assessment to determine if you or a loved one are eligible for the program. Anyone can make a referral to our program, including self-referrals, primary care physicians, specialists, family members, friends, community group members, nursing or residential facilities, or church peers.
Okay, so let's now maybe transition to talk specifically about women's mental health. First off, why is it important to address women's mental health separately?
So mental health is something unique to each of us that can be influenced by many factors, and gender is one of them. According to the World Health Organization, 29% of women are treated for mental health disorder compared to 17% of men. Anxiety is 2 times more common in women than in men. Eating disorders are 3 times more common in females than in males. And even with those statistics, women tend to underreport their mental illness, especially during pregnancy and postpartum, because of the stigma and a fear of losing their children in general.
Wow, those are pretty staggering. What are some of the risk factors for mental illness specific to women?
According to the American Psychiatric Association, some of the risk factors that are specific to women include acting as a caregiver, poverty risk, and violence. So they may spend as much as 50% more time as caregivers than men, and being a caregiver can often be mentally exhausting and cause increased stress and anxiety. For women aged 18 and over, the risk for poverty is about 3% higher than that of men of the same age, often making it difficult to access mental health. And research shows that 1 in 3 women have experienced violence from a partner in their life, and victims of violence often suffer from PTSD, anxiety, and or depression due to the violence they suffer.
Aside from risk factors, are there any signs or symptoms of mental illness unique to women?
Yeah, so some signs and symptoms tend to indicate that a woman may be struggling with their mental health. Some of those include chronic pain, continuously thinking about the same thoughts, feeling lonely, headaches, stomach aches, high blood pressure, weight fluctuations, a low sex drive, and withdrawing from loved ones.
So, what are some important things women should know about maybe improving their mental health?
There are a few things we could do to improve our mental health. One is to build healthy sleeping habits, and that's by creating a healthy routine that you follow each night, avoiding caffeine or nicotine late in the day, and creating a comfortable sleep space. Exercise is important. You can exercise as little as 10 minutes a day and enjoy the benefits from it. And then knowing when to ask for help. Knowing when to ask for help is very important. And then making social connections a priority is a big part of being at your best mentally and emotionally.
So let's now transition to heart health and its connection to mental health. Is there a correlation between heart health and mental health?
Yes. So the American Heart Association has done research to determine the significance between heart and mental health in recent years. The findings from this research have proven that the heart and mind are connected and that they are often dependent on each other. If something impacts the heart, it can also affect the mind and vice versa. So one of the most significant findings from this research is that while poor mental health can have a negative impact on our heart, it's also true that positive mental health can help reduce risk and improve heart health in general. With these findings, we now know that adding interventions to help people cultivate positive mental health can significantly impact improving their heart health.
What are some signs and symptoms to look for in someone who may be at risk for depression after a cardiac event?
Some of the most common symptoms are agitation, an increase in anger outbursts, changing in their eating patterns or sleeping patterns, a definitely overall decrease in their energy or just general fatigue. They may express concern about the future or fear of dying. They may show signs and symptoms of PTSD related to that cardiac event, and they may be struggling to make lifestyle changes.
So what are some ways people can improve their mental and heart health?
So there are a few ways. There's meditation. There's some positive psychological techniques, which are like acts of kindness, and keeping a journal. It's called a gratitude journal. And then you can always seek professional help.
Wow, this has all been really great information, Chastity. How can people who are listening learn more about Senior Life Solutions?
So if you want more information, education, or just discuss support options, you can visit the Henry County Health Center's website at www.hchc.org or give us a call at 319-385-6552.
Awesome. Chastity Lang, Senior Life Solutions Program Director here at the Henry County Health Center. Appreciate you coming on this morning to talk about mental health. Wow, we've learned a lot this morning.